So we're going to do our little treatment on Jenny. I've had a quick assessment of her skin. She's a little dehydrated and needs a little bit of love. So we're going to be using our Wire Fusion, and the combination of serums I'm going to use is the HA solution, which we want obviously to improve her hydration and moisturization of her skin. And the second one we're going to be using is the multivitamin. I just think her skin needs a little bit of food just to perk it up a bit. So the plan will be I'm going to use 1.25 of each of the solutions in equal combinations. So I'm going to be using a 2 ml syringe, and I'm going to be using a 23 gauge needle. The size of the needle doesn't really matter. You can use a 21 gauge, you can use an 18. I think whatever in your clinic is what you'd use. Okay, I'm going to take the cap off. Generally what I tend to do to help with aspiration is I'll just draw the syringe back with some air. That's already sterile, so I don't need to clean it, and just inject air into there, which gives me the opportunity to draw up the amount that I want. Okay, so I'm just going to, just get rid of my air there. Yeah, and then I'm just going to inject back enough, pull the needle out. I'm going to separate it, but I'm actually going to leave the needle in. Okay, we're going to put the solution into the vial, and I'm using the syringe, not the needle, because it makes it froth. Secondly, it's avoiding a sharp potential hazard there. I'm just going to draw up the next one, using again my 23 gauge needle. Pop the cap off of the HA. Now this is a little bit more viscous, so actually putting the air into the vial is going to make life a lot easier in terms of aiding my aspiration. I think with this, because it's slightly more viscous, I'd probably go to a 21 gauge needle as opposed to 23. But as I say, it's whatever you've got in your clinic, whatever you're happy with. Okay, just going to get rid of that air, and I've got enough, so draw out, leaving that needle in, and then I'm just going to add the HA. As I say, it's slightly more viscous. Going to put the cap on, which I'd had inverted, and now what I'm going to do is don't screw it too tight. I'm literally just going to swirl it round just to mix it. Don't shake it, because it might end up being a little bit frothy. What I do now is that we slowly invert the vial, and what you're trying to see is the solution filling in with the cap. I'm going to have to come down because I'm too tall. So you want to make sure that you don't have any bubbles. Just pump it a little bit just to make sure that you get rid of all of the bubbles and you've actually got solution in there. Okay, and I'm actually very happy. I can see it because obviously the solution is slightly pink, that actually my chamber is ready. Okay, what I'm going to do now is I'm going to make a start with Jenny's face. Okay, so what I've done before I've started the procedure, I've actually opened the vial and I've actually applied a little bit with the tip of my finger onto Jenny's skin, so that we're just going to start. And then what I generally tend to do is just hold the head and then literally just press it, making sure that you overlap. Okay, it might be a little uncomfortable round about where this nerve pathway is, so you may feel like you want to sneeze, Jenny. If you do, just let me know, okay? How's that comfort-wise for you?
Yeah, it's fine.
Try not to go too fast. You want to make sure that you're getting all the solution in. Right, I've got a tiny little bubble that I can see there. You probably won't be able to see it, so I'm just going to give it a tap, and then I'm just going to press that nipple again. And I think that's gone now. Okay. How are you feeling? All right?
Yeah, it's fine.
Okay. Yeah, I think that's okay. Okay, and as you can see, she's got a little bit of erythema there. She is touch sensitive with her skin anyway, but like you would get with the microneedling system, you've got a tiny bit of erythema there. All right, Jenny, I'm just going to turn your head slightly to the left. Okay. So on a scale of 0 to 10, Jenny, with 0 being no pain, and 10 being the worst you've ever experienced, what would you say?
I would say it's a 2.
A 2. So you can pull up your big girl's pants and be okay.
Yeah. It's comfortable. You can obviously
You can feel it. Okay. Brilliant. Okay. I'm going to turn you to the side. The advantage of being at the head of the patient is that you can actually, I can't move because I've got lighting here, but you're not only turning your patient's head, but you're also moving yourself. Okay. And we just go around, making sure that you overlap each side. Okay. Jenny hasn't got any, but I think if you've got anybody who's got some fine lines or a few little crepey bits of skin here when you're doing the eyebrow, if you just pull it up above the bony margin, and actually very quickly, because this is a little bit more tender, just give it a little bit of a microneedle. You're right there, Donna, I'm sorry. I didn't warn you before I attacked you. There you go. Okay. I'm just going to be by your nose now, okay? And you just literally just keep stamping, turning the head as we go. And as I say, you can see your areas because we've got some erythema. Right. Yeah, okay. So, airlock, upend it, and then very slowly tip it in. Right, okay. We got rid of that airlock now. Okay. You all right, Jenny?
Fine, thank you.
Same principle if you're wanting to target the lower lines on her lower lid. Just get hold of the cheek, pull it down onto the bony margin, and ever so quickly, just do a little bit of stamping. Always do it on the bony margin, you don't want to be stamping eyes. It's very uncomfortable. Great. And we just carry on doing what we're doing. It's a lot more tolerable on the cheeks, obviously, because they've got a little bit more padding. Foreheads generally tend to be a lot more uncomfortable because it's basically skin on bone. Okay. How's that feeling? I'll just do a little bit more here. Okay, I'm just going to do your chin now, my love. Keep checking and making sure that you haven't got any bubbles and that when you're doing your stamp that you're actually getting solution coming out onto the skin. Okay, just going along the jawline here. Again, this might be a little bit more uncomfortable, darling, so I'm going to just go a little bit quicker. But you can definitely hear it because you can almost hear that. Can you hear that sucking, Jen?
Yeah, I can.
Okay, just do a little bit on this chin. Got filler in there. Great, okay, I'm going to do the other side. So I'm just going back now to the other side of Jenny's head. What's really important in order to get maximum serum coming out and the device to be working, you really need to be perpendicular to the skin, all right? You can't be at an angle, perpendicular. So don't be afraid of moving your patients' heads, but you want to be directly perpendicular. And what you're doing is making sure that you've actually got direct contact and that you're stamping overlapping so that you're actually stamping onto liquid. All right, Donna, I'm sorry, I know you found this a bit more uncomfortable. Okay, I'm just going to turn your head. So it's really important that you keep it directly perpendicular. If you don't, it's not going to work. Because what needs to happen in order for the liquid to come out is that tiny little nipple needs to be depressed completely. And I'm not sure if you can see it, but you can see that we have got product coming out onto Jenny's forehead. Okay, so I'm going to turn you just a little bit more that way. You comfortable?
Yeah.
Okay, perfect. Which direction you go doesn't really matter. I think it's a personal choice. Right, I think I've got a bubble there, so I'm just going to tip it again. Get all of that solution and very gently tip it to fill. Okay, sometimes I just give it a little flick. I know Claire doesn't say that, but I do. I think you learn your own techniques as you go. What works for you is fine in my book. Okay, I'm just going to go a little bit down here, Jen, because I've got you in a nice angle, and then I'll go back to your cheeks. Can you hear that sucking?
Yeah.
Okay, I'm just by your nose now, sweetheart. Okay, so when you're moving from an area to another area, try not to upend your device. Keep it going down. It's not going to leak out. But if you've been getting good flow and your technique is fine, what you don't want to do is you don't want to get your airlocks. Turn again, my sweetheart. Thank you. Jenny's responding very nicely to the technique. So actually my end points I can see is the erythema. If you've got a little bit of excess fluid on the skin, just near the eyes, I would just wipe it. You don't want it running in. Don't think it's going to make any difference, but it's not particularly pleasant for them. Okay, little flip. Okay, back again. And as you can see, you can get a good 2.5 mils into the patient's face and give you a really, really good result. You okay, my darling?
Fine, thank you.
Perfect. Okay, now this is the nasty bit, my love, which is your top lip. So what I need you to do is I need you to roll in your top lip for me, please. Okay, and I'm going to go, as you can see, Jenny jumped. It's not pleasant. It's a little bit more tender, a little bit more uncomfortable. Okay, relax. Okay, do you want to roll again? This is one more. It's Thursday, so you have 2. And go a little bit quicker. That's it, I'm sorry. I'm just being mean. There you go. Okay, my darling. The other side. Okay, brace yourself, no jumping. It's hard not to. I appreciate that. I'm so sorry. But that top lip's going to look amazing. So all of this pain will be worth it. There you go, my sweetheart. Well done. All of it will be amazing. I know you don't like me very much now. Okay, so the last bit now, with a little bit of product that we've got left, we're just going to do her nose. Jenny does report to me that she says that she's got fairly oily skin. So I'm hoping that this will certainly help to reduce the potential that she's got for any blackheads or little spots coming up. You've got a few open pores there. All right, again, not particularly pleasant. Okay, just put a bit of tension on that nose, just to make sure that you've got it directly perpendicular. Okay, and then just wipe that serum. You don't want it running in her eyes. Okay, don't wipe it with a tissue because you're just taking all of that good stuff. Okay, Jen, do you want to turn your head the other way? That's lovely. Okay. Here we go. Okay, I'm just going to do down the bridge of the nose now. Boom, boom, boom. Perfect. Sorry, that made you jump.
That's all right.
I'm sorry. Yeah, no, it did make you jump. Yeah, no, it's just I didn't want any of that liquid to just run into your face. Okay. We've got a little bit left in our little device. So what I'm going to do now, because I obviously don't want to waste it, I'm just going to put a little bit on her skin and just literally use the rest. Okay, and all of that will now absorb as we've created all those lovely micro channels. Okay, just keep your eye closed. Sorry, made you jump again. I should warn you what I'm doing
so
to you. No, I don't blame you. You're coming near your eye. Perfect. Okay, so what I'm going to do now, just to calm it down, because I'm sure Jenny feels like she's been completely sunburned, I'm going to put some lovely Wow hydrating serum on, just to give her added topical moisture. Okay, one of the things that you need to do, particularly with your patients, is irrespective of what the weather is like outside, you do need to put on at least a 50 sun protection. All right, they shouldn't go out without it. Okay, that's nice and soothing. How does that feel now, Jen?
Yeah, that's lovely.
Okay, perfect. Thank you very much, my love. You're a little pink, but that's a good thing. Wonderful. Do you want to lift your head up? There you go.
Thank you.
Revealed. Perfect.